So I found it quite useful to learn about the subjects that come in handy in certain healthcare professions. So for example, how something like chemistry is more applicable to pharmacology, whereas optometry, for example, takes physics more into account, and that's more useful.
I didn't realize that social care and particularly helping people with learning disabilities, things like that, were actually a viable thing going forward if you want to be a healthcare professional. Some way to apply your love of people, dealing with people outside of just science.
I think that it's been useful because my daughter's been able to speak to people that are actually doing the job that she feels that she may want to do once she's done her GCSEs, gone to university. So it's been useful in that respect.
I love absolutely everything about my job. I think the most interesting part is actually being in the community, supporting people. Especially with Age UK, we support a lot of vulnerable people, people with long-term health conditions like dementia, and people that have had falls and strokes. So it's about going out and about and making sure that they're independent and healthy, they're aware of what services are out there, and making sure they're socially connected as well, so we're breaking some of the social isolation that's available for older people at the moment. I mean, I think the younger people that are here today are looking sort of work placements, and they don't really know what the charity sector does. So we've really been talking to them and telling them, you know, what kind of great work we do in the community, and encourage them to come and do work placements and volunteering with them.
What I get out of these events is I love talking to potential recruits, sharing the love for my job, but also we get to maybe debunk some of the myths about the London Ambulance Service, and also not many people know about the pathways into it, so it's a good opportunity to spread that message and get people interested in doing it as a job. I'm passionate about my job, and I'm passionate about the LAS and the way we help people in London, so getting more people to share those values and getting to come and do that job is really rewarding. And also getting just to chat to some, you know, interested, motivated young adults that are just keen and starting out. It's just brilliant.
I think one of the most important ways in which we can attract students into social care and health is by arranging work experience to allow them to get an insight into, or for that matter, a taster into what they are going to take up as their career, and which is very important. And to be involved in babies before birth, and to be able to look after them after birth right till the age of 16 years, and to make a difference to the family unit, not only the child.
I think exhibiting to students and being here today is important because it gives students the opportunity to clarify the different courses that we do, and also to look at different fields. A lot of people don't know what midwifery is, or what child nursing is, or the differences.
So what palliative care means,
palliative care.
A lot of those questions today.
So that really helps us to not only promote the university and promote the healthcare field that they're in, but also allows them the chance to clarify and find out from the students who are actually doing the course.
I think it's very important for the students to know exactly what we do, or nursing per se, what's actually involved in a nursing career. And from my placements, I found one area that I was really interested in, and that was community nursing with the district nursing team. And I said, that's exactly what I want to do. And from there I've developed, I've been a diabetes nurse, and I've also come into community matron as well. So it is an interesting career. There's lots of openings available to kind of like diverse your career as well. So I think it's really interesting for the students to know what's actually involved in this.
And what I really wanted to do was to really talk to students about the questions that they have. So they've asked me about becoming a GP, and what I've tried to do is just to tell them about being able to reflect, being able to just enjoy the experience, and that was really important for me to be able to speak to the kids about that. And I think what general practice gives me, what doing medicine gives me, it gives me the fulfilment of a career that I really enjoy. Sometimes you do feel quite isolated as a GP, either within your own local community, your own practice, and just getting out there and meeting other community clinicians, fantastic.
I think exhibiting to students is really important to make them aware of different nursing roles, different ways into nursing and the way that nursing has changed, and dispelling some of those myths that surround nursing, like it's just for girls or that you need 3 A levels to get into university to study it. So I've really enjoyed talking about the difference. One of the key themes that has come out of this evening for me is the importance of work experience and exposing people to roles early on. I think lots of young people don't realise that you can do it. And especially getting them into different areas, so things like learning disabilities and community health, not just hospital-based nursing.
Said just getting our profession out there, getting people excited about radiography, and just putting the passion that we have for our work and what we do, conveying it to people and letting them know the variety of areas that we work in. We're not just working with x-rays, we're working with CT scans, MRI scans, working in such a variety of areas in the hospital, A&E, theatres, on the wards, we're literally everywhere. So 95% of patients who come through the door will see a radiographer at some point. So I think it's really important just to convey to people that that's a profession that you can get into as well.